Knock, knock. Hi, my name's Grace. I'm a student nurse from Clemson. I'm going to be working with you today. I'm going to be working under my instructor, who's your primary nurse for today. So I'm just going to go over here and wash my hands. How are you doing?
I'm good.
And can you tell me your name and full date of birth?
Elizabeth Blanco, January 9th, 1997.
Great. Can I see your wristband? Perfect. So I'm just going to close the curtain right here. So what we're going to be doing today is I'm going to be doing a head-to-toe, just full-body assessment. Nothing too invasive, nothing to worry about. But at any point, if you feel uncomfortable or have any questions, just feel free to stop me. So first, I'm going to be taking your vital signs. We're going to be starting with blood pressure. So what I'm going to do first is I'm going to get your approximate systolic blood pressure by taking your radial pulse. Do you have a preference of which arm?
No.
There we go. Does that feel good?
Yes.
All right. So I'm going to find your pulse. Okay. There we go. Okay, so I lost the pulse at around 110, so I'm going to pump you up to about 130 when we do it for real. I'm just going to resituate this. This is tighter on you. There we go. Okay, so I got your blood pressure at about 108/70, which is within normal limits. That's really good. Everything's good there. Get rid of this. So next I'm going to do a quick examination of your skin. Just before we start, do you have any family history or personal history of any skin disease?
No.
Do you have any moles that have changed significantly over the last year?
No.
Okay, good. And do you wear sunscreen?
Yes.
Good, glad to hear it. Okay, so what I'm going to have you do first is hold your arms out for me. So Liddy's skin is warm, dry, it's evenly colored, and there are some nevuses scattered throughout, but they're all small and round with even borders, so that's good. And next, there's no present abnormalities, there's no rashes, lesions, no excessive bruising or anything like that. So all of Liddy's visible skin is intact without any abnormalities going on there. So next I'm going to check turgor. So I'm just going to have you by your hands. I'm just going to pinch your skin right here. I'm going to do this hand. Okay, so Liddy's skin is smooth, easily mobile, and has good turgor, which means you're nice and hydrated, so that's good. Next, we're going to do a thorax and lung exam. So basically what I'm going to be doing there is listening to some respirations and just making sure there's nothing weird going on with your lungs. So, first off, do you or anyone in your family have any health history, including lung disease, lung cancer, or anything like that?
No.
And do you smoke?
No.
Do you have any history of asthma, bronchitis, pneumonia, anything like that?
Mm-mm.
Okay, do you have any allergies?
No.
Okay, perfect. So, first, just right off the bat, Liddy has no cyanosis, no pallor that is evident. She's clearly not in any sort of respiratory distress, no nostril flaring, no use of accessory muscles. Her thorax is symmetrical and her AP diameter is less than her transverse diameter, so all that's looking good. What I'm going to do now, Liddy, is I'm going to listen to your lung sounds. I'm going to start in the front and then do the back, so just bear with me while I do that. Okay. And please take a deep breath. Sorry, every time we move. Now I'm going to get right under here. Okay, good. Now I'm just going to have you sort of sit to the side for me so I can get your back. Thank you. And again, just take a deep breath every time I move the stethoscope. All right, ladies, so everything sounds good. What I was hearing there is, so over your, over your bronchial area, or over the trachea and the larynx, I heard bronchial breath sounds. And then over your, over between your scapula and over your bronchi, I heard bronchiovestibular lung sounds. And then vesicular sounds were heard over your peripheral lung fields. And all that was heard bilaterally, anteriorly and posteriorly. So that's good, that's all normal. And then there were no advantageous lung sounds, no rails, wheezes, crackles, anything that would make us concerned. So that's going to be all for the lung and thorax exam. Next, we're going to move on to the cardiovascular. So first, I'm going to start again by asking a few questions. Do you or anyone in your family have any history of any cardiac disease, anything like that?
Nope.
Heart attack, stroke?
No.
So would you say that you get enough exercise?
Yes.
And do you eat a balanced diet?
I try.
You try? Okay, good. So what I'm going to do first is I'm going to palpate your peripheral pulses. So basically I'm just going to be feeling all over your body to make sure the blood is pumping well enough.
Okay.
I'm going to start with your carotid pulse, which is right here. Okay, so Liddy's carotid pulse is equal bilaterally with a grade of 2+, so that's within normal limits, and that's good. Next, I'm going to do your dorsal pedis pulse, so that's going to be right on the top of your foot here. Okay, so the dorsal pedis pulse is also equal bilaterally and with a grade of a 2+. Next, I'm going to do the posterior tibial pulse, which is just going to be right back here. Okay. Okay. Liddy, so your posterior tibial pulse is equal bilaterally with a grade of 2+. Next, I'm going to do your brachial pulse, which is just this one right in here. And then next I'm going to do femoral, which is right under here, sort of about this, get a little close. Okay. All right, and now I'm going to feel your popliteal pulse, which is going to be right behind your knee here. Okay, Liddy, so all pulses are equal bilaterally with a grade of 2+, so that's all good, everything looks good. Next what I'm going to do is I'm going to auscultate your apical pulse. So what's interesting about the apical pulse, which makes it different, is it's along about the 5th intercostal space, which is right around here, and then it's at the midclavicular line. And it's actually right at the apex of the heart, which means it's the point of maximum impulse. So it's the point where the blood is really pumping, and that's why I'm going to palpate that for a full 60, or I'm going to auscultate that for a full 60 seconds. So what I'm going to do is I'm just going to have you lean forward for me. Just lean forward a little bit, and then it's going to be right around here. Okay. So your apical pulse is about 70 beats per minute, and it's a grade 2+. So that's good. That's all within normal limits, and there were no weird extra S3, S4 murmur, anything like that sounds heard. So what I'm going to do next is I'm going to listen to your heart sounds. So I'm going to basically be listening to your different valves of your heart to make sure everything sounds good. I'm going to start by using the diaphragm of my stethoscope, and then I'm going to go around a second time and use the bell. So first, this is the aortic location right here, and it's at the second intercostal space right along the right sternal border. Okay. This is the pulmonic location, which is also along the second intercostal space, but it's along the left sternal border. All right, here, this is called Erb's location, or Erb's point. It's along the third or fourth intercostal space at the left sternal border. This is the tricuspid location right here, and it's along the fifth intercostal space at the left sternal border. Okay, then this is the mitral location, and it's at the fifth intercostal space at the midclavicular line. Okay, good. Now I'm going to go back through and listen to all those spots again with the bell. Alrighty, okay, so all heart sounds were present, all S1 and S2 was present, sounded good, and there were no extra S3, S4 murmurs, rubs, anything like that. And so lastly, for the cardiovascular portion, I'm just going to check for edema, which that would just indicate some excess fluid that you were retaining. That wouldn't be good. So I'm going to get down here. First I'm going to check in your shins. Ankles, okay, looks good, your feet, and then your hands. Okay, so Liddy has no pitting edema, which makes her a grade 0 bilaterally. Alright, so next, Liddy, we're going to do the abdominal exam. So first, again, I'm going to start with some questions. Do you or anyone in your family have a history of gastrointestinal disease? Nothing like that? Okay, and have you ever had any sort of abdominal surgery?
No.
Do you ever feel any severe abdominal pain?
No.
Okay, great. So what I'm going to start with having you do, is just, if you could just lay down for me, just get comfortable. Yeah, I'm going to have your knees slightly bent. Great. So first, would it be okay if I just pull your shirt up a little? Okay, cool. Alrighty. So just first off, Liddy's abdomen is flat, smooth, it's symmetric. Her umbilicus is at the midline and it is inverted, so all that looks really good. So what I'm going to do first is I'm going to auscultate for bowel sounds. So I'm just going to do that in the 4 quadrants of your stomach using the diaphragm of my stethoscope. Okay, Liddy, so bowel sounds are active in all 4 quadrants. That's good. Now what I'm going to do is I'm going to go back through with the bell of my stethoscope and listen to your major abdominal arteries. And this time I'm just looking for bruits, which would be good. So first I'm going to start with the aortic artery, which is right up here. Okay, and now renal. Here, and also here. Okay, now your iliac arteries. And last, your femoral, which is right here. Okay, ladies, there were no bruise present, so that is good. And now what I'm going to do is I'm going to palpate your abdomen. So what I'm going to do first is I'm just going to do a general palpation, which means I'm going to start with light palpation and then go a little bit deeper right after that. So, rub lightly here, and I'm going to go deep. And stop me if you feel any tenderness or discomfort. It's light. I'm going to go deeper. Okay. And deeper. Alright, so I didn't feel any masses, no enlarged organs, no abdominal distension, rigidity, tenderness, nothing like that. So your abdomen's, everything felt good. So what I'm going to do next is I'm actually going to palpate your spleen. So your spleen is going to be on your left side. And how I'm going to do this is I'm going to just put my hand here. I'm going to press up under here and then have you take a deep breath for me in just 1 second. Okay, let me take a deep breath. So the spleen is not palpable, which is normal. That's within normal limits. That's good. If it was palpable, that might mean it was enlarged or something like that. So now I'm going to palpate for your liver. So that's going to be on your right side. So I'm going to do the same thing over here, basically, and I'm going to push up under the ribcage. Sorry, it's my hurt. Okay, now can you take a deep breath for me? Great. Okay, so Lydia's liver is smooth with rounded edges. That's within normal limits. That means everything's looking normal. So good. That is that's all I had to do for the abdominal exam. So now we're going to move on, and I'm going to check out your eyes really quick. So you can sit back up. I'm going to grab my pen light. So again, do you have any family history of blindness, cataracts, anything like that?
Nope.
Do you yourself wear glasses?
Yes.
Do you wear contacts?
Yes.
Okay. And when did you start wearing them?
Around my freshman year of high school.
Okay, and everything with that's going good though? They're working
Yes.
out? Okay, great. So first, I'm just going to your pupils. So Lydia's pupils are around, I'd say, 4 millimeters bilaterally. So what I'm going to have you do, Lydia, is I'm going to have you follow my pen light, okay? Let me start here. Okay, now follow it again. Alright, now I'm going to have you focus on the wall behind me. Okay, now focus on the light. Alright, great. So Lydia's pupils are equal, round, reactive to light, and accommodative at 4 millimeters bilaterally. So everything with your eyes looks great. Next, we're going to move on and do a quick examination of your neck. So basically what I'm going to do with your neck is I'm just going to probably feel around and make sure there's no like weird stiffness and all that your nodes and everything feel good. So first off, do you ever feel any discomfort in your neck?
Mm-mm.
Do you ever just get a really, really stiff neck in the morning? Nothing that will limit your range of motion? Good. And do you ever have any unexplained difficulty swallowing? No. Okay, perfect. So what I'm going to do here is I'm going to palpate your 10 cervical nodes. So I'm going to tell you which ones I'm doing while I do them, and I'm just going to feel them a little bit. So this is your preauricle. Post-auricle. This is your submental, submandibular, tonsillar, your occipital, and your anterior cervical, posterior cervical, your supraclavicular, and then your inferior clavicular. Alright, Lydia, so there was no visible or palpable lepharopathies, which that is good, and all of your nodes were mobile, non-tender, and so everything felt good. So next what we're going to do is we're going to assess your musculoskeletal system. So I'm going to start out, do you or anyone in your family have any history of any sort of musculoskeletal diseases? No. Nothing like that? Do you ever feel any unexplained muscle pain, any cramping or twitching? Okay, good, good. So basically what I'm going to be doing here is I'm going to be just assessing your joints and then your range of motion of those joints. So what we're going to do first is I'm going to look at your hips. So if you would just get up and walk across the room for me, just, yeah, there and back, that's good. Okay, you can sit back down. All right, so Liddy's gait is steady and smooth, and her iliac crest is symmetrical, so that's good. What I'm going to have you do next, I'm going to have you lay down for me again, and then we're going to check the flexion of your hips. So how I'm going to do this is I'm going to have you raise each leg just straight up one at a time to check flexion. Good. Okay, next we're going to check hip flexion. So just raise your knee to your chest for me, just one at a time. Great. Keeping this leg straight, which is good. So next we're going to check internal and external rotation. So if you could just lift one knee up at a time and then rotate it outward, so external rotation, and then inward, internal rotation. Okay, good. And then if you could do it this leg too. Great. Okay, and now we're going to test abduction and adduction. So for abduction, if you could just spread your legs out, yeah, and then pull back in for abduction, yeah, perfect. Okay, and so now if for this last part you could stand up for me, and we're going to test hyperextension, which is just you pulling your foot back one at a time. Yeah, perfect. Okay, great. You can sit back down. All right, so Liddy has full range of motion, which makes her a grade 5, so that's good. So next after hips, we're going to go to your shoulders. So first off, I'm going to have you stand up for this. To test flexion of your shoulders, I'm just going to have you raise them up in front of you all the way above your head. And then for extension, all the way back down. Perfect. And then for internal rotation of your shoulders, I'm going to have you move inward and touch back towards your scapula. Perfect. And then for external rotation up towards your head. Great. All right, now for abduction of your shoulders, I'm just going to have you put your arms straight out. Perfect, great. Okay, so Liddy has full range of motion of her shoulders and equal bilaterally, and that's a grade of 5. So after your shoulders, we're going to go to test the range of motion of your neck. So first what I'm going to have you do, well, right off the bat, Liddy's neck is aligned, her head is erect, and her spine is straight up and down, so that's good. What I'm going to do to have you test flexion is I'm just going to have you put your chin to your chest, and then for extension, look all the way up to the ceiling. Great. Okay, then for lateral bend, I'm going to have you touch your ear to your shoulder, just one at a time, obviously. And then, yeah, great. Okay, then for rotation, your chin to your shoulder, just like that. Okay, looks good. So Liddy has full range of motion on her neck, which is a grade 5. So next what we're going to do is we're going to check the range of motion of your elbows. So for your elbows, just first off the bat, no, there's no redness, swelling, no deformities, nodules, anything like that on your elbows, so that's good. And all we're going to do to check flexion here is I'm going to have you bring them up towards yourself and then extend back down. Good. So Liddy has full range of motion of her elbows, so that is good, and that's a grade 5. Next, we're going to be doing checking the range of motion of your knees. So again, I'm going to get down here. So Liddy's knees have present concavities on either side of the patella, and there is no present edema, which is good. Liddy's knees are normal sized, they're normal shape, and they're equal in size and strength bilaterally. So that's good. And so what I'm going to have you do to test flexion of your knees is all I'm going to have you do is pick up your foot like this, like you're going to hop on one foot. Good. Okay, good. So Liddy has full range of motion of her knees, which is good. So next, we're going to test the range of motion of your spine. So I'm going to have you turn around so I can look at your spine. Good. Okay. So Liddy's spine is straight. There's no odd curvatures, no scoliosis, kyphosis, lordosis, anything like that. So to test flexion, I'm going to have you bend all the way down, touch your toes. Then for extension, have you lean backwards. Great. Then for lateral bend, just kind of side to side. Yeah, that's good. And for rotation, just kind of twist around. Great. Okay, perfect. So Liddy has full range of motion of her spine. So that's good. Next, I'm going to test your hands and your wrists. You can sit down if you want. First, just looking at Liddy's wrists. No nodules, no deformities, nothing weird. I'm going to palpate some of the joints in your hands. So all of Lydia's joints are smooth and non-tender. So for flexion, what I'm going to have you do is I'm going to have you point your fingers down, and then for extension up, then I'm going to have you spread your fingers out like that and make a fist. And then lastly, I'm going to have you touch each of your fingers to your thumb. Great. Okay, perfect. So Lydia has full range of motion in her hands and wrists, and that's equally bilateral, and that's a grade of 5. So lastly, for the musculoskeletal, I'm going to check the range of motion of your feet and your ankles. So first, I'm going to check to circumduct your ankles, which I'm just going to kind of just around your foot. So there's no crepitation there, which is good. That means that you're not cracking or doing anything weird. So first, what I'm going to have you do for flexion is I'm going to have you point your toes down, and then point them up, and then point them down against my hand. Do it again. Okay, then up against my hand. Perfect. So Lydia has adequate strength in her plantar flexion and dorsiflexion. So next what I'm going to have you do is we're going to do an eversion and inversion. So first I'm going to have you point your toes towards each other. Great. And then eversion away. Perfect. And then flex your feet and put them straight up. Perfect. Okay. So Lydia has full range of motion in her feet and ankles with no crepitation. So that is good. Next what we're going to do is we're going to do a neurovascular portion of the exam. So what I'm going to do here is I'm going to go through each of the cranial nerves to make sure that they're intact, functioning properly, and all of that good stuff. So first we're going to start with the olfactory nerve, and how we're going to test this one is I'm going to do the smell test. So I'm going to have you close your eyes. I'm going to give you 2 different objects to smell, and then you can tell me what they are. Okay, your eyes closed? Mm-hmm. Perfect. Now can you tell me what this is?
Nail polish.
Okay. And then can you tell me what this is?
Peanut butter.
Perfect. Okay, so Lydia's olfactory nerve is intact and functioning properly. Next, we're going to test your optic nerve. So how I'm going to do that is we're going to have you look at the eye chart. So just stand back about this far. Perfect. And then I know you did say you wear contacts or glasses. Do you have your contacts in right now?
Yes.
Perfect. Okay, so can you cover up one eye and read the third row for me?
2843.
Okay. And now can you cover up the other eye and read it for me?
2843.
Perfect. Okay, so Lydia's optic nerve is intact and functioning. So next what we're going to test is the oculomotor, the trochlear, and the abducens nerves. We're all going to have one test, and what that is called like the H test. So I'm going to have you follow my finger in all directions. Follow it with your eyes. Okay, perfect. So your oculomotor, trochlear, and abducens nerves are all intact and functioning properly, so that is good. Next what we're going to do is we're going to do the trigeminal nerve, or the trigeminal nerve. And so how we do that is I'm just going to have you clench your teeth and move your jaw around. Do you feel any pain, any weird sensations with that?
Nope.
Okay, perfect. So that means that your trigeminal nerve is intact and functioning properly, so good. Next, I'm going to have you do, we're going to test your facial nerve. So all we're going to do with that is I'm going to have you smile, frown, puff out your cheeks. Perfect. So it's all symmetrical, which means your facial nerve is intact and working properly. So the next one we're going to do is the acoustic nerve. And so what I'm going to do is called the whisper test. So I'm going to have you cover up one ear, and then I'm going to whisper something in the other ear, and you're going to tell me if you can hear it.
Okay.
And when you can hear it, just repeat it out to me.
Snake. Snake. 3.
Okay. Now, we can try this side.
Boy. Boy.
Mouse.
Mouse.
Perfect. Okay, good. So that means your acoustic nerve is intact and functioning properly. So next we're going to do the glossopharyngeal and the vagus. So how we're going to do that is I'm just going to have you open. I'm actually going to use my pen light for this. And I'm going to have you open your mouth and say ah. I'm going to look at your uvula in the back of your throat. Perfect. Okay, so So your uvula is symmetric and reactive and right at the midline. So that's good. That means your glossopharyngeal and the vagus nerves are both functioning properly. Let me put this back. Okay, and so now I'm going to look at the spinal accessory nerve. So all I'm going to do here is I'm going to have you shrug your shoulders. One more time. Perfect. Okay, so it was all equal, symmetrical, happened at the same time. So that means that the glossopharyngeal nerve is intact. Everything's looking good with that. So, or that was the spinal accessory, oops. And then, so lastly, we're going to do the hypoglossal nerve. And what I'm going to have you do is just stick out your tongue. Good. Tongue is in the middle of the mouth. It's symmetrical. Looks good. So all of Liddy's cranial nerves are intact, reactive, and they're functioning properly. So that's all really good. Next, what I'm going to have you do is I'm going to test some of your reflexes. So what I'm going to do is I'm going to use this hammer and I'm going to watch for the right reactions. So what we're going to do first is I'm going to do your biceps. So I'm going to need you to really relax here. You relaxed? Okay. Perfect. We're going to do the other side. Relaxed. Perfect. Okay. Next, we're going to do the triceps. So again, I'm going to do chill. It's going to be right here. Okay. Now we're going to do this side. Okay. Perfect. Now we're going to do the brachioradialis, which this is going to be on your wrist. So just on your wrist. It's going to be right on your thumb here. Got the twitch that we wanted there. Perfect. Okay, next we're going to do the one that I'm sure you're familiar with. It's called the patellar. I'm just going to have you sit up a little bit better on the couch for me. Perfect. Then I'm just going to strike right at your patellar. We're going to look for your foot to move. Oops, that's the wrong spot. Sorry, it's hard telling these pants. Okay, and on the side. Okay, perfect. So now we are going to do the Achilles. So that's going to be on the back of your foot here. Okay. Okay, perfect. And lastly, I'm going to do the plantar reflex, which means I'm just going to draw a little J kind of symbol on your foot, and then you're going to see the reflex that your foot makes. Okay. Okay. Perfect. All right. So all of your reflexes are reactive bilaterally. Everything looks good. So I think you're good. And that concludes our head-to-toe full physical exam.
Thank you.
Oh gosh, how do I stop it?
You'll just have to chirp it.